The one repetition maximum protocol assesses the maximum amount of weight an individual can lift. For the bench press 1RM protocol, the subject will first warm up by completing a number of sub-maximal repetitions of the specific exercise that will be used to determine the 1RM. Initial weight will be determined based on the subject's 50 to 70% perceived capacity. The resistance is progressively increased by 5 to 10% until the subject cannot complete the selected repetition. All repetitions should be performed at the same speed of movement and range of motion to instill consistency between trials. The 1RM will be determined within 4 trials with rest periods of 3 to 5 minutes between trials. The last weight lifted successfully will be considered the 1RM. The protocol for the squat 1RM is similar to that of the bench press. The individual will first begin by performing a warm-up consisting of sub-maximal repetitions of the specific exercise. The squat protocol consists of increasing the resistance in a progressive manner by 10 to 20%. The 1RM will be determined within 4 trials, with rest periods of 3 to 5 minutes in between trials. The last weight successfully lifted will be considered the 1RM. The 1RM protocol can be dangerous and induce injury if not performed correctly. It is important to consider such limitations when assessing certain populations such as younger individuals and older adults. Reps to fatigue can be an alternative for the 1RM protocol. This procedure is similar to that of the 1RM except for the resistance used. For a submaximal protocol, a lower resistance is utilized and the number of repetitions performed will predict the 1RM. After performing the reps to fatigue protocol, a formula can be used in order to predict the 1RM value. The formula consists of dividing the weight lifted by 1.0278 minus 0.0278 times the number of repetitions. It is important to note that the formula is only valid for reps to fatigue that consist of less than 10 repetitions. The push-up protocol is administered with men starting in the standard down position. Hands need to be pointing forward and under the shoulders, back straight, head up, using toes as a pivotal point. Women will be performing the modified knee push-up. This position consists of positioning the legs together, lower legs in contact with the mat with ankles plantar flexed, back straight, hands and shoulder width apart, head up, using the knees as a pivotal point. The subject will raise the body by straightening the elbows and returning to the down position until the chin touches the mat. Back must be straight at all times and the subject must push up to a straight arm position. The protocol is stopped when the client strains forcibly or is unable to maintain the appropriate technique within 2 repetitions. The maximal number of push-ups performed consecutively without rest is counted as the score.